Dr. Ennis, we talked, you gave a fantastic dissertation on drug testing and why it is quite a good thing to do it. In fact, to just recap those points, for companies who are not mandatory needing to do it, but let's talk about those ones, because the ones who are mandatory doing it, they're doing it anyway. And any small company, you said even you test your people, is that you can advocate to your prospects and to your existing clients that your people are probably slightly more trustworthy in terms of not making drug-related poo-poos at least. And one big thing which intrigued me was that perhaps the guy who is honest already but might be playing with the thought of taking drugs will not do it because he knows he eventually gets tested randomly and doesn't know when that is. So he doesn't want to chance it because he's basically not really into it anyway. And you simply do keep people straight and good and stuff like that. I'm not sure there was something else there. But so let's assume you find a guy who is testing positive, and is obviously a no drug policy. Otherwise, there'll be no reason to do drug testing, right? There's probably a no tolerance level for drugs, and I'm fully for it. But does everybody right away have to be fired, or is there such a thing as rehabilitating? Is there such a thing as getting people back? Because like a mom can't just shoot her son because he's on drugs. She's going to try to work on getting him back to normal, right?
Yes.
Is there anything the employer can do? Are you assisting the employer with it? If so.
Yes, there's a lot of things that can be done.
Really?
Certainly, if it's a repetitive offense, then there's a problem. But if this is a first-time situation, there's a lot of things that can be done. And there are many excellent drug and alcohol counselors that are placed really throughout the United States. We have 2 or 3 that we use in our firm for the cases that are positive for us. And normally what we do is when we have a positive drug screen and we have declared that the drug screen is in fact positive, we recommend that the donor submit to a drug and alcohol counselor. The drug and alcohol counselor will interview them, go over their personal drug history, try to find the causes of why they were taking drugs, give them educational classes depending on the kind of drug that they were on, have some additional counseling, and by way of persuading and convincing them and giving them the mental tools necessary to understand that the use of drugs is not a good thing. And so there are a lot of things that can be done.
And you will assist the employer with it. And help him, maybe even give him information even before he finds a drug here. You kind of like supplying the employer with like some literature which he can loosely pass out to employees so that they know and say, hey, it maybe isn't so good. Not that none of us has heard that already, from school on and everywhere, but in this type of areas, I do think nothing works, personally I think nothing much works better than, so to say, repetition of, what's going on and why and what, so that people go, I don't want to.
Yeah, you're absolutely right. Certainly we've made ourselves available to go out to different employer clients and to give talks and to have, I have a presentation that I can give an employer client to a group of employees, particularly to their supervisors. So their supervisors have the tools and the armaments to be able to go back to their employees and say, okay, look, this is what we're going to do. This is why it's important. And this is how we're going to function under this drug screening policy. And so it works best if the whole organization, by way of an employer, if the whole organization is involved, if there's just one or two people in the organization that want to do it and nobody else does, it's a hard thing for them to accomplish. We can help either kind of firm by way of what we do in terms of the random collections and the drug and alcohol counseling afterwards. But it's a fascinating subject and important for clients, particularly if they're in a manufacturing plant and they have to exercise fine motor skills as well as fine thinking skills in terms of making judgments. It becomes very important.
Well, I'm sure it does. So rehabilitating is definitely an option, and it's a good option. Again, except the lost guy. There's, with no doubt, we all know that this is a toughie. But rather than that, and of course, I think the most important prevention already, did you find that, I think you did say, but I'm not so sure, that just doing the testing will cut it down, because so many drug users are this like, well, I went out on Saturday night and we did it, but okay, I guess I won't do it anymore that fast. And then they do it again 6, 7, 8 months later, fine and dandy. But the point is, drug testing could cut that once or twice a year use down also, and that in itself must be a tremendous positive effect to the individual, never mind to the company, who is risking now to have an employee who makes a mistake and maybe hurts himself and makes production mistakes and cuts production. But it just like keeps lots of more people healthy, right?
Oh, absolutely. Certainly, companies that have enough of a population of employees that can have random selections at least once a month find a tremendous benefit, because their whole employee base never know, well, is my name going to be drawn this month? And so having a random selection list generated for them on a monthly basis is very helpful.
I use sometimes, I think this random selection thing is done by a computer, right?
Yes, it is. Actually, it certainly is. We have a random number generator in our computer that randomly selects one out of the group that's there. The group may be as large as 2,000 or 3,000, maybe as small as 5, and the random number generator will pick one number out of that group. Now, some of our employer clients, if they've got large numbers, may want to have 10 or 20 selections out of that group, and certainly we do the same. We use the same procedure to do that 20 times or whatever times are required to satisfy their compliance needs.
And is it possible that a guy who got a testing this month gets it again next month, so that he doesn't think, oh, I'm fine now. That's it. There are 100 of them. We test 3 a month, so I'm good for a year. Or can he be called again?
That is one of the most frequent questions that I get, and particularly somebody that gets picked 3 months in a row. They want to know, well, did my employer call you and tell you to pick me? And of course, that doesn't happen, and if it did, we wouldn't accept it.
Watch it.
Yeah, that's exactly right. A random number generator, in terms of a random drug screen, you have the same chance of being picked every month. And so if your chances are 1 in 100 to be picked in January and you're picked, you're still going to have a chance of 1 in 100 in February to be picked again. So you have the same percentage every selection process to be picked.
Got it. And do the employees know that?
Yes, they do. Sometimes they have a hard time understanding it, particularly if they're picked in sequential months, and so they have some difficulties understanding that. But certainly the answer to your question is yes, they do. Particularly over a period of time, they do.
Good. All right. Well, wonderful. Again, thank you very much.
Thank you.